If you have knee arthritis, you may notice difficulty standing up from a chair or standing up from the floor. I'm Dr. Dave Candy, and in this video, I'm going to share one common but often overlooked reason why you may have difficulty standing up. Plus, I'll give you some easy, actionable tips that you can use to help you stand up more comfortably without knee pain. So let's get started. Many people with knee arthritis focus on doing exercises to improve the range of motion in their knees, as well as the strength in their quadriceps or thigh muscles. If you've researched the issue a little bit more, you may also know that strengthening your glutes or butt muscles is important. The one often overlooked problem is ankle joint mobility. Now, many people do try stretching their calf muscles, but typically the way that people stretch their calves is with their heels hanging off the edge of a step or doing a runner's stretch somewhat like this. But the problem with those type of exercises are in both of those exercises, your knee is straight. But when you're standing up either from a chair or from the floor, your knees are bent. And so that takes your gastrocnemius or calf muscle out of it. There's a deeper calf muscle called your soleus, which is sometimes involved, but another really common issue is mobility in the ankle joints itself. And if you have a joint mobility problem, you need a joint mobility solution. Your ankle really actually has two joints. It has the talocrural joint, a joint between these two bumps or malleoli on your ankle, and then the talus, a triangle-shaped bone that sits inside. Now, the talus needs to be able to move between those two bumps in order to get your foot to move up and down like this, or to be able to load your weight over your feet as you're standing up from a chair. And if you don't have mobility in that talocrural joint, you can get additional mobility from another joint in your ankle called the subtalar joint. But that joint doesn't move in a straight forward and backwards. It has an axis at about a 45-degree angle. So to get additional movement from that subtalar joint, it causes pronation or flattening of your feet, which can cause your knees to knock inwards and cause knee pain. Furthermore, you may just lack mobility and not be able to get enough weight loaded over your feet to be able to get a good push off to stand up. So the exercises that I'm going to show you are joint mobility solutions to address a joint mobility problem in the talocrural joint. To do these exercises, we're going to use some bands to help mobilize your joint. One option is to use a small loop band like this, which is really convenient and easy to use, but it is rather easy to stretch, so you don't get as great of a joint mobilization with it. The other option is to use a pull-up band like this that is much thicker and stiffer, and so you get a better joint mobilization, but it is a little bit more cumbersome to use. So I'll show you both options and you can use which one works best for you. So first we'll start out with just this little loop band. These are very inexpensive. You can purchase them on Amazon. And I'll put a link in the description below. But you put it around your ankle like this so that it hits right at the crease of your ankle. Then you loop it around your opposite ankle, and this ankle is the one that we're going to be stretching. So for this, you want to have your foot flat on the ground, toes pointed ahead, and knee over top of your foot. And then you're going to lean forward like this, kind of like a mini lunge. And the key points are you want to keep your heel flat on the ground, and if you're seeing it from the other side, you also want to keep the arch of your foot lifted. So you don't want to allow your foot to flatten down like that. If you need to hold on to something for balance, that's perfectly fine. And then just stretch forward like that as far as you can while keeping your heel on the ground and your arch lifted. What this does is the band pulls backwards on the talus and helps pull that bone backwards in the joint, which it needs to do in order to get appropriate motion at that talocrural joint. So you'll just kind of lunge forwards and backwards like this, oscillating back and forth about 15 to 20 times. And just go back and forth, and that helps mobilize the talus to get the joint moving a little bit better. It also stretches out that deeper soleus muscle, one of your calf muscles that does not cross the knee, which can also be problematic when you're standing up from the chair or when you're standing up from the floor. Now, the second option is to use this loop band. And like I said, this will give you a better joint mobilization, but it's a little bit more cumbersome to work with. To use it, you'll fold it in half like this, then you'll take it and you'll wrap it around the joint that you want to mobilize. Then you'll put the two ends together and step through both ends at the same time with your opposite foot. Now, once you have it set up like this, the exercise is really exactly the same as the other one, but you do get a much better joint mobilization or a stronger backwards pull force from this thicker band. And so it's a little better of a joint mobilization. But if it's too cumbersome for you to work with, the little loop band may be easier for people who have more balance problems and would have difficulty kind of getting this situated correctly. Another thing that you can do with this band is to do a chair mobilization. So if you have too much trouble putting weight out on that sore foot, you can also put your foot up on top of a chair like this. Then you can use the band to pull backwards on your talus this way. You don't have quite as much body weight over top of your ankle in this case, but you're still getting that posterior glide force from the band, which helps to mobilize your ankle joint. Then once you've done those things, it's time to get up from a chair. So to do that, I'll turn sideways here. You want to pull your feet back towards you as far as you can while keeping your heels on the floor. It's really important to keep your heels through the floor because that's how you activate your glutes, by pushing through your heels. Now, to do this, you want to scoot to the front edge of the chair so you can get your feet as underneath of your body as possible. Again, try to keep your heels flat on the floor. Then you're going to lean forwards or hinge forwards from the hips, and that allows you to get your glutes into the motion. Then instead of standing up by straightening your knees, you're going to stand up by leaning forwards, and this shift of your body weight almost naturally straightens your knees without you having to do a whole lot. Then once you've done that forwards lean, just push your hips underneath of you using your glutes, and that allows you to come up to a standing position. So again, scoot to the edge of the chair, pull your feet underneath of you as much as you can while keeping your heels on the floor. Hip hinge until your bottom naturally starts to leave the chair, and then squeeze your glutes to push yourself back up to standing. And that should significantly decrease how much pain you have when standing up from a chair. Now, to get up from the ground, we're going to do somewhat of the same movement. You're going to get your heel flat on the floor, bring your knee forwards as much as you can comfortably. Then you're going to hip hinge from here, stick your bottom up in the air, walk this foot forwards, and you're up. So again, heel flat on the floor, knee over toe as best you can, hands down to kind of brace and balance. Come up like that by pushing your bottom up in the air. This doesn't take a lot of thigh strength because you're using physics and leverage to help you. Then you just walk this other leg underneath and you're up from the floor. So hopefully you found those tips helpful to stand up from a chair and stand up from the floor with less knee pain. Now, if you need additional help for knee arthritis and you're in the St. Louis area, we'd be happy to help you out here at More for Life. If you're watching this from somewhere else, you can check out other tips to help you stand up from a chair more easily or get up from the floor more easily in these videos over here. But before you go, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.